So I've checked my chart, I've checked the orders, I've checked for patient allergies and sensitivities, and there are none. I've gathered my supplies, and I'm going to enter the room. Hello, my name is Morgan. I'm a student nurse. I'm going to wash my hands. I'm going to identify the patient. Can you tell me your name and date of birth, please? And I check it against her armband, and everything matches. I also check it against her chart, and that matches. So the doctor has ordered an IV to be inserted. An IV is just a small plastic cannula that goes into your vein so that we can deliver medication to your bloodstream. To do that, I need you to sit very still. I'm going to poke a needle into your vein, and the needle has a plastic cannula over it that slides in, and the needle comes out, so the needle does not stay in your arm. You're going to feel a small pinch when I insert the needle, but after that you shouldn't feel anything. In order to do that, you have to sit very still. Will you be able to do that for me? She says she can. Do you understand what I've told you about this? She says she does. Next, I'm going to select my site for insertion. I'm going to provide privacy. I'm going to take my bed protector. You want to make sure that you use, if at all possible, you want to make sure that you use the non-dominant arm because it reduces movement and there's less chance of infiltration and extravasation and all that. A good vein is one that is straight, it has no bulges, and is large enough to accommodate the IV. You want to stay away from joints. You don't want to go in the antecubital space or towards the wrist, or you can use the dorsal aspect of the hand, but it's more painful for the patient. So I've placed my bed protector just in case we have some small drips. So then I'm going to apply the tourniquet 15 to 20 centimeters above where I think I might insert the IV. When you place the tourniquet cannot stay in place for more than 2 minutes. You want to check for a radial pulse to make sure that you have not obstructed arterial blood flow. And then you feel or look for a good vein. If you can't find one, you can gently tap, or you can have the client pump their fist, or you can remove the tourniquet and place a warm compress for 10 to 15 minutes. So I found my site. Next, I'm going to get my supplies ready. So first thing first, this is supposed to be sterile, but because it's not, I'm going to clean it. And then you take your flush, making sure that you don't contaminate that. Make sure this is dried completely. And you make sure there's no air in your flush, which usually there is. And you flush it. This is supposed to have a cap on the end, but mine is lost, so I'm verbalizing that the cap is on the end. And you put that there. Also, this is my last needle, so I'm only going to verbalize that I'm engaging the safety. I know that you always engage the safety and never recap a needle, but I'm only verbalizing it this time. because they're expensive and the HLRL will fight me on getting another one. Okay, so there's that tape, Tegaderm. Okay, so now that I have my supplies ready, I'm going to don clean gloves. Ooh, don't do that. Okay, and I'm going to apply the tourniquet again. Check for a radial pulse. Find my site. And I'm going to clean the, I'm on my lunch break and that's my radio from work. I have to wear that in case they need to get a hold of me. You clean the site, starting in the middle, working outward. You allow that to dry completely. Then you take your needle, you take bevel up, and with your non-dominant hand, careful not to contaminate the site, you pull the skin taut. Then at a 15 to 30 degree angle, you insert the needle, and when you see the flash, you go parallel to the skin and you advance about half a centimeter more. Then you advance the plastic cannula up to the hub. And pull that out, and at this point I would engage the safety. Now I remove the tourniquet, and I would remove the cap from this. Then I would check for blood return and flush. 3 milliliters. And yay! Okay. Then we tape. When you tape, you don't want to tape over the insertion site, and you don't want to tape the hub. You want to tape right in the middle. And once you've got your first tape on, you can let go. And you put your Tegaderm on over the insertion site. Yeah, with the tourniquet. Oh no, okay. It's the seam of the chub. And then save your label. So label it with the date, time, and initials. Thursday. And you lock this. You can take your flush off. You ask the client if they're having any pain associated with it. You watch for signs of infiltration. You want to make sure that an IV should be flushed per company protocol every so often to make sure that it's patent. My tape on there, got it taped down good, I got it labeled. At this point, I'm going to I put pores off the top, I love it. At this point, I'm going to take my supplies. I'm going to make sure that the client has her call light within reach. Ask her if she needs anything before I go. I'm going to make sure that I have all my supplies and dispose of them properly. I'm going to remove my gloves. I'm going to chart the time of insertion, the fluid used or the flush used, the size of the needle and cannula, any other details that I can think of. Forgetting something. What am I forgetting? Make sure she's safe. She has a call light. If she doesn't, I make sure she does. Going to remove my gloves. I'm going to. There's something I'm supposed to verbalize and I don't remember what it was. Okay, well, I can't think of it. So I guess that's it.